Hello, I'm Jennifer Sorensen, the Executive Director with the Minnesota Home Care Association. I'm excited today to talk to you about e-health in the state of Minnesota. There are several economic and social factors at play regarding the world of technology. The first is the number of baby boomers that are turning 65 every day. People are living longer, more productive lives that requires ongoing health care and maintenance. We have an increase in medical advancements beyond what we had ever dreamed of. The number of infants and preemies that survive each day, the number of disabled adults living longer are a couple of other examples. For all of that, it produces an economic need. More people living longer with complex medical conditions, and add to that the individual choice that people have to stay at home and out of facilities. Care in the time and place when one is in need is our future. So how do we do that? The political pressures that people want affordable, effective, efficient health care when and where they want it. As you can see, the changes that are happening at the federal level to capture the public's wants. The ACA, the healthcare exchanges, and yes, the technology advancements to support the future of healthcare. The Minnesota mandate regarding interoperable electronic health records is an extremely important factor for my members to consider while looking at technology. Home care is part of the continuum of care, and that piece of care takes place in the home. Being able to bring that level of information and communication to the physicians, therapists, and specialists, etc., is imperative for good quality care to take place. Home care agencies need to be looking at technology that will connect them to the full continuum of care and that the client-patient receives the best possible outcomes. The payers in our state are very interested in helping home care agencies become more technology focused. They are wanting to have the most advanced technology. This helps us to streamline the billings and claims processes and communicate back and forth in a time-effective manner. It also helps the payer to see the total patient and all of the care that they are receiving, and thus being able to manage cost, care, and decrease duplication of services. The other piece is the client-customer. If the payers and the providers have good technology and can communicate quickly and efficiently, the customer benefits. It's a win-win for everyone. There are several challenges for home care agencies in our state and across the nation. As many know, the technology requirements are there, they have a high price tag, and home care agencies do not have the capital to invest much. The concerns are that they will not be able to afford the technology that's required. While the fiscal concerns remain, the opportunity to change business models, bring a value add is exciting. Agencies that have embraced the opportunities have looked into partnerships, collaborations, and grant opportunities. The chance to break down silos and create a true continuum of care is on the horizon. The overall experience of the client, consumer, and customer of healthcare and the home care services will benefit the most. They will have better access to their own records. They will have control over when and where they go. They will not have to deal with signing papers, faxing, and waiting for documents to arrive before the start of care can take place. The process will be seamless, less stressful, and more client-focused. The benefits to the caregivers are limitless. The ability for a caregiver to be in the home at any time and have access to the communication and deliver changes in care to the physician is such a benefit. Rather than having a visit, listing the changes, sending them in, and waiting to hear back, it all can happen at the visit. Real-time care for the client in the home, and thus the caregiver is more effective and efficient. I had stated prior to the concerns for home care agencies and the cost of technology. The reality is that the future is technology, and yes, it will become the must-have to be in business. Clinics and hospitals are only going to be willing to partner with agencies that can communicate with them. I see that the reality is just around the corner, and agencies need to start planning for it now. Education, research, and connecting with partners over the next year will be important for the future of their businesses. There are some really good tools put out for providers to educate themselves, prepare and research the best options for themselves. MDH provides health information technology information on their website. There are other software agencies that provide toolkits, and Stratus Health has done an excellent job preparing a home health specific toolkit for home care agencies to utilize. It walks agencies through the lines of questions and research that they need for due diligence in their search for the best product. In closing, I just want to thank you all for the opportunity to talk about home care today, the future of home care, and the importance of interoperability of the healthcare record. If you are a provider, I recommend starting now. Utilize this wonderful resource to help your agency and make a sound decision regarding technology.